Now I'm going to talk a little bit about international and migrant students who have a very strong accent. Sometimes, particularly older patients who are quite hard of hearing or get quite frustrated with students and indeed colleagues who they don't understand. And unfortunately, this can reflect badly on the student or your colleague, because older people particularly get very frustrated very quickly, and sometimes they can be quite rude to the student, and it causes quite a lot of upset with students. Also amongst colleagues, colleagues can get very frustrated with their colleagues when they don't understand them, particularly on the phone. So if you're working with a student who has a particularly strong accent, there are things that you can do. Now, a lot of preceptors, teachers, supervisors in practice say to me, I don't want to say anything to the student because they think I'm being rude or they think I'm being racist. But what I say to students is, my job is to help you to pass your practice placement. And one of those things that you have to pass is called your communication skills. So if people can't understand what you're saying, it's very important. So what I want to do now is help you by helping you to modify your accent by doing one of the three following or four following things. Now, it might be just one of them. It might be, and a good way to start this conversation with a student is to say this, because it's respectful. You're not saying, what? I didn't understand you. Oh, for heaven's sake, can't you speak more slowly? Instead of that, you're saying, I'm listening to you really carefully, but can you please speak a little more slowly? Sometimes that's it, especially with some students from the Indian subcontinent when they have excellent English. In fact, grammatically and their vocabulary and grammar is probably up there in the 90th percentile as far as English language is concerned. But sometimes their accent is very difficult to understand, and sometimes they speak very quickly. And I've got a colleague from southern India, and I've said to her, you know, what should I say to students? And she said to me, well, when I am speaking English and it sounds really slow in my head, that means that Australian listeners can understand every word I say. And I said that's a really good strategy, so I now use it with students who speak too fast for Australian ears to understand what they're saying. So I say, when you speak slowly and it's slow in your head, then it's just right for our ears, because we don't hear accents very well. It's something Australian listeners find very difficult. So if you take some responsibility about being the listener, that also helps that situation, because you're not just saying, oh, for heaven's sake, just speak English properly. You're saying, I'm listening and it's my responsibility to do that. But to help me understand, could you please speak a little more slowly and finish every word before you start the next one. Another one might be volume. They might have a very quiet voice and they might not be able to be heard. So then I would say to a student, I'm listening very carefully to you, but you need to turn up your volume a little bit. You need to speak a little more loudly so that we can hear everything you say, because what you say is very important. So those are a couple of strategies. So speed, volume, and tone. And the other thing about tone is very nuanced. We might go up to somebody who's got pain, for example, and say, I can see that you've got pain. I'm just going to have a look at you and your drug chart and see what we can do about that to make your pain, to make you more comfortable. Now, the look that I've got on my face when I said that is nuanced, because I've got hopefully, a look of concern and interest on my face, and that is me using my Western face in a Western environment to a patient or a client who's going to understand what I'm saying to them because of the tone of my voice, and the tone of my voice is congruent to the look on my face. Now, this is something we learn how to do. So if you have a student who seems abrupt or goes to a patient and in an abrupt way and says something which makes them feel worse, maybe it is about their pain, then you might need to say to that student, what you need to do is adjust your tone to a gentler, more soft tone, and say what you can say. What I say to students is, watch the way I'm talking to this patient. Come and watch me now. Don't say anything. Just watch me. Watch the look on my face. Listen to the tone of my voice and look at how close I am to the patient. And what am I doing with my voice and my body posture? I'm leaning forward, I'm showing concern, and that will give that person the message that you're interested in them and that you want to help them. So when you've got a student who has an accent that is difficult, that needs to be addressed, because the language of the Australian healthcare system is English. But we do need to get better at listening, and you need to tune in. So that's another thing that you can say to students is, I'm doing my best to tune into your accent, but I need you to speak more slowly. So it's not a question of being rude. You want patients to understand this student. You want to be able to understand this student when they're demonstrating their knowledge base to you. And if you can't understand the accent, then it needs to be worked on.